We'll formally begin the webinar. Hello, everyone. Thank you very much for joining us today. Welcome to the 20th webinar of Energy Evaluation Asia Pacific, where we discuss the non-energy benefits of weatherization and energy efficiency programs. My name is Nazir. I'm your host for today's webinar and a coordinator with Energy Evaluation Asia Pacific, which is a vibrant community of energy and evaluation professionals across the Asia Pacific region. Before we go into the webinar, I would like to inform you that this webinar is being recorded. We would also like to invite you to kindly introduce yourself in the chat, sharing with us your name, your organization, and the country you are joining us from. And in one word, what comes to your mind when you hear non-energy benefits? While you are doing that, I would like to share with you some quick housekeeping rules. As I said, this session is being recorded, and by attending and participating, we assume you give us your consent for this to happen. But if you have any concern, please feel free to reach out to us. Kindly keeps your microphones muted when you are not speaking, but you can switch on your cameras for better engagement. Please use the chat box for questions for the speakers. They will respond to the questions at the end where we have a dedicated Q&A session, but they may also respond directly in the chat. At the end of the session, I will share with you a brief feedback form, and we will be happy to hear your comments, suggestions, and also if you would like to be part of future webinars as speakers. This session is being recorded and it will be uploaded on our YouTube channel and on our website. I will put the link there. And we will be sharing with you the session notes along with recording and as well as the slides through email and through our social media pages. The agenda of today's webinar looks like this. We will start with welcome remarks and background of the topic from Edward Wine, who is a steering committee member at Energy Evaluation Asia Pacific. Then we will have presentation from our two keynote speakers, Dr. Bruce Tonn and Michaela. We will have a dedicated Q&A session at the end, and then we will try to wrap up the session at 10 a.m. Without further ado, I will hand it over to Ed. Ed, over to you.
Thank you. Share. You can see my slide?
Yes.
Thank you. Thanks, Nazir, for starting this webinar. Really important topic. I'm glad we're able to introduce people to this topic, and for those already knowledgeable about non-energy impacts, you'll learn the latest, which is always good. But before that, I want to introduce people to Energy Evaluation Asia Pacific. It was established in 2018, and it was modeled after the one in the United States that has been going on since 1983, the evaluation conference called IEPEC. And then later in Europe, we've had one since 2010 called IEPPEC, now called Energy Evaluation Europe. And it is a community of people who supports the evaluation of energy policy and programs in the Asia Pacific region.
Du möchtest deine Karriere aktiv vorantreiben.
If you could please keep yourself muted.
Eine ordentliche Gehaltssteigerung möglich. Mach's wie ich. Schreib dich ein.
Thank you. Okay. Yeah, I'm looking at that.
Right. And the mission is to take a leadership role in expanding the practice of and capacity for objective evaluation in the energy efficiency and renewable energy program and policy arena. And our strategy to do that is to develop resources and professional expertise to answer complex questions related to energy, including which actions pay off, how energy programs and policies can be improved. That's a really critical question in area that we try to show the benefits of evaluation, and then what actions can be scaled up. So what we'd like to do, strategy, is foster the development of self-sustaining evaluation communities through our workshops, conferences, webinars, and other web-based tools. Our focus is a collaborative approach with many different stakeholders. I won't go through the list here. And focusing on the importance of really good evaluation, robust evaluation, data analysis to inform policy decisions. And we do this conducting capacity building initiatives through, as I mentioned earlier, training, workshops, technical assistance programs where we can. And we prioritize post-implementation monitoring and evaluation, and we try to track the outcomes and impacts. That's the focus of our group. We have a steering committee, we have an advisory committee, and we have a coordinator. Nazir here is our coordinator. I'm on the steering committee, and we have a number of different people participating in each of these committees, as you can imagine. Focus again, why are we involved? We're really focusing on policy adoption and implementation, behavioral change as well, and then the economic and environmental benefits. And we think we have a role to play, bringing in the key stakeholders in each of these areas and introducing them to EEAP and seeing what EEAP can do to help them. And usually it's, we're focusing on the whole region, but often it comes down to country by country. We have a number of tools we use for communicating what we're doing. Obviously, we have email, and LinkedIn has been very active for us in spreading the word. And then we have recordings of the webinars as one example that we place on YouTube. So later, for example, after this webinar, people who cannot participate can later go to YouTube and watch the recording. And we have our website as well. So today's webinar, as you probably all know, is titled Measuring What Matters, looking at the non-energy benefits of weatherization and efficiency programs. We have two speakers from the same company, 3Q, and I'll introduce them shortly. But we'll have Bruce talk first, have a short break, and if there's some questions that we can address right away, and then Michaela will talk. And at the end, we've reserved time for more questions, and Nazir will show the agenda in a sec. I did want to mention one important thing that recently came out. So this is just not a US activity, but the International Energy Agency have been involved. We've been involved with them over the years on multiple benefits of energy efficiency. And they've had some earlier reports, but earlier this year, they came out with a report called The Multiple Benefits of Energy Efficiency. And I provided the link, where you can go to the website and get that report. So I encourage everyone to look at that to see what their latest thinking is. So I think I'm going to stop here. And then Bruce can, let's see.
Το Σάββατο όχι το Σάββατο, την Παρασκευή.
Bear with me 1 second. Here we go. So while Bruce sets up his slides, he's the co-founder and president of 3Q, which is a nonprofit research organization located in Knoxville, Tennessee. Their mission is to foster equitable, sustainable futures. I've known Bruce for almost all his 40 years of experience, particularly I met him when he was at Oak Ridge in the energy program evaluation field. He has done lots of work in estimating the non-energy impacts of low-income weatherization and other energy efficiency programs. And he has his degrees from Stanford, Harvard, and Northwestern universities. So Bruce will have about 15 minutes for his talk, and I'll hand it over to Bruce.
All right. Thank you very much, Ed. And glad we can be here to talk with you all about non-energy impacts of weatherization. So let's see. A little bit about, we're actually, 3Cube is a nonprofit research organization located in Knoxville, Tennessee, which is in the southeastern part of the United States. It's just near Oak Ridge National Laboratory where I used to work, and also at the University of Tennessee in Knoxville. We do specialize in estimating the impacts of energy efficiency programs, the non-energy impacts of energy efficiency programs. We also engage the community here in Knoxville and in other communities on topics related to energy burden, energy equity, food insecurity. We work for utility companies here in Tennessee and also in Massachusetts. So we do a lot of different things, but we really got our start looking at the non-energy impacts of energy efficiency programs. So let me provide an overview. So what is low-income weatherization? So weatherization is a term of art used here in the United States to represent programs that are either funded by the federal government, hopefully in the future, utility programs in states that install comprehensive sets of energy efficiency measures in low-income homes and also in affordable multifamily buildings. So those measures include insulation and air sealing, repairing, replacing air conditioners and heating systems, putting insulation around ducts and water heaters and things like that. All of the measures that are installed are guided by energy audits. And so there's an energy efficiency test for the measures that we put into homes. And generally, weatherization means that these services are free to the low-income eligible households. So what are non-energy impacts of weatherization? So those are changes in important variables that are not energy related. And I'll go over the types of things that we found in our research. These benefits could accrue to the households themselves, to society, or even to ratepayers. And we assume that the benefits could last the lifetimes of the weatherization measures that are installed in the homes, which could be as long as 20 years. We have a theory of change as to why we believe that non-energy impacts could happen after you put these weatherization measures into homes. So a key point is that there are physical changes in the home. So you're putting these measures in the home. It's not like we're only relying on behavioral changes, for example. So for example, if you seal up the house to keep hot air in or keep cold air in a house, you're reducing the infiltration of allergens and things that may impact asthma. You're improving the thermal comfort of the house. You're reducing the growth of mold and moisture, and you're also reducing the intrusion of noise into the house. So all these things can have a direct health impact. So if you have less allergens, people with asthma may have less asthma symptoms. If the home is more thermally comfortable, people with arthritis may suffer less, and in extreme cases, lives may be saved because people are not dying in their homes because they're too hot or too cold. Reducing the infiltration of noise can help people sleep better, and that can reduce stress and improve cognitive processing. On the other side, putting in the measures can directly save money. So households are spending less money on energy, utility costs, but also sometimes they'll come in and reduce change the hot water temperature settings, and so you may conserve water. And we find that households are better able to pay their utility bills And so they're less likely to undergo costs related to utility disconnections and reconnections. So you save money and health is directly improved. And both of these things can then interact with each other. So for example, if you are healthier, people who are working are less likely to miss days of work. And for low-income workers who don't have sick leave, for example, or paid time off, that means that there's more money in their bank accounts. On the other hand, if you have more money, you might be able better to afford food. And if you're able to afford more nutritious food, you'll be healthier and work better. So we have this nice model that lays out why we believe that low-income weatherization can produce these non-energy impacts. And based on this model, we can then work on how to collect data to do our evaluations. So we measure non-energy impacts in several ways. The main way we do it is we survey weatherization recipients before they get weatherization and after they get weatherization. Plus, we work hard to establish control groups that we can also weatherize in those, we can also survey in those 2 periods. You can take direct measurements. So we are working on a project with the University of Michigan that's funded by our National Institutes of Health, where we're looking at the sleep benefits of weatherization. And so we give participants a sleep watch 1 week to wear 1 week before their homes are weatherized, and they wear it again 1 week, 1 year after their homes are weatherized. We could take blood pressure tests. We also collect medical records, Medicaid records to directly measure changes in claims for different types of illnesses like asthma, and also directly measure costs related to medical care. And then in some cases when we, for very infrequent events, for example, if we put in a carbon monoxide monitor into a home that could save lives from carbon monoxide poisoning, that event is so infrequent that we really can't collect enough data to do that kind of study. But the secondary literature will have impacts of carbon monoxide monitors on saving lives. And so we'll go to the secondary literature also to collect data that we can use, information we can use to do our non-energy impact assessments. So we've done several major projects. We've done one where we estimated the non-energy impacts of DOE's Weatherization Assistance Program, a national study. Tennessee Valley Authority is the local federally based utility here in Tennessee. We've looked at the non-energy impacts of their low-income weatherization program called Home Uplift. And then we also received a grant from a major foundation here in the US and money from utility companies in Massachusetts to study the NEIs associated with weatherizing affordable multifamily buildings in the Northeast and Midwest. So the results I'll be presenting to you are a combination of all of these studies that we've done over the years. So basically, we have found that respondents will tell us that their home conditions have improved, which sets the basis for all of the health improvements and other NEIs. And our respondents say that their general health has improved post-weatherization. There's reductions in acute health events like hospitalizations. There's improvements in household finances, and there's improvements in life satisfaction. And I have a few comments to make on each of these. So home conditions. Post-weatherization households are less likely to keep their homes at unsafe temperatures. Recipients report reductions in drafts, mold, mildew, and standing water, all which could have health and benefits. And they also report reductions in noise and odors and allergens from the outside. So all of those lay the groundwork for all the other NEIs. So our strongest result is that our weatherization recipients say that their physical and mental health improves post-weatherization. And so that's asked with the question of, over the past 30 days, how many bad days of physical health did you experience? And over the past 30 days, how many bad days of mental health did you experience? Then also over the past 30 days, how many bad days of rest and sleep did you experience? And for all of our studies, the respondents say that their physical health is better, their mental health is better, and they sleep better. And they also report they have fewer headaches and respiratory illnesses, and we believe that's because of air sealing and keeping allergens out of the house. And then also fewer, noise is reduced as well. Fewer acute health events. And so acute health event in our terminology is you have to go to emergency department or you have to go to the hospital. And we find that our respondents have fewer medical interventions post-weatherization due to thermal stress, arthritis, and asthma. And there's, using the secondary literature and a model that we built, we estimate there are fewer deaths from carbon monoxide poisoning and fires because of low-income weatherization. A lot of the measures that I mentioned may not directly deal with fires, but the weatherization crews are allowed to do some electrical work in the homes, and about 10% to 20% of what they spend on a home can focus on health and safety. So a lot of the electrical work can, reduce fire risks. Replacing a faulty furnace can reduce the fire risks, and so fires are reduced post-weatherization, and that will reduce both injuries to occupants and also death. Household finances. All the households say that utility bills are more affordable, with one caveat. So about 75% of the homes say that they can't afford, that their utility bills are unaffordable pre-weatherization, but 50% still say their utility bills are unaffordable post-weatherization. So weatherization is not a magic bullet to improve household finances, but it really makes a big improvement. Households report less likely needing to trade off buying food and medical prescriptions to pay utility bills and vice versa. And there are also reductions in utility disconnection notices and disconnections. So household finances are better post-weatherization, but they're still, they're still classified as low-income households. We also ask questions about life satisfaction because we think if their homes are more comfortable to live in, maybe they'll be more satisfied with their lives. And we do find that the respondents report that their lives, improve satisfaction with their lives, their quality of life, and with their neighborhood. And these are especially strong with respect to weatherizing affordable multifamily buildings. They're more likely to invite people into their homes post-weatherization and socialize, and they feel better about where they live. And so those are major and important things we believe as non-energy impacts. So this last slide here, and we looked at those 5 categories of results from our surveys and try to imagine how they would interrelate with each other. And, does weatherization then impact this household system of home conditions, financial problems, life events, life satisfaction, and general health problems? And we do find using 3-stage least squares simultaneous equation modeling that all of these things are related to each other. But the most important thing that we find from this model is that general health is the node for this model. So that if you improve health, then people are better able to work and they have more money, and so their financial problems are less. If their health is improved, they're better able to take care of their homes. If their health is improved, they're more satisfied with their lives. And so the more that we can do to append to weatherization programs that help health, the better that this whole model works out. So my concluding thoughts are that the NEIs to weatherization are considerable. They can be enhanced by blending in healthy homes measures and climate resilience change measures into weatherization. And then based on my last point, we really want to encourage healthcare and public health organizations to invest in weatherization, not just the energy efficiency programs and utility companies.
Great. Thank you, Bruce. Before we go on to the next presentation, I want to remind people who are on the call to please, if you have questions, we have time at the end, depending how much time to address your questions, but you can always put it in the chat and element, and in the chat you can ask your questions and we can make sure we get to those as well. One quick question for you is regarding what would happen to these people being participants in the weatherization program if there was no weatherization program. Would they be able to participate in other programs, or are they basically left on their own and given their current situation?
Given that they're low income and given that they haven't had their own money to invest in energy efficiency measures, they'd be left on their own. There are some programs where you can pay out of your utility bills or pay off a mortgage, but we don't like those programs because it just places those low-income households in more financial risk. Oftentimes, weatherization programs walk away from homes because they're in such bad shape, and then they're left on their own also to fix their homes before they can be weatherized, and then that rarely happens either. So it's I think these are very important programs for this population.
Yeah, definitely. Okay, we'll start with our next presenter, Michaela. She has over 7 years of experience working with utilities and public agencies to evaluate energy programs, particularly for low-income residents. She's been working with others on U.S. Department of Energy report on the energy burdens for participants in this weatherization assistance program. She's worked on a lot of research on health benefits resulting from low-income residential weatherization in different states and regions of the U.S. And her research does focus a lot on statistical modeling and qualitative surveys and interviews with the weatherization recipients. She has a MS in Public Policy Management and Data Analytics from Carnegie Mellon University. And as you can guess, she specializes in using data analytics, machine learning, mapping, and geographic information systems for social good. So without further ado, Michaela, you can continue the presentation.
Thank you so much, Ed. And thank you everyone for being here at an inconvenient time for many in the Asia Pacific and for accommodating our time zone in the US. I also wanted to say, to follow up on Ed's introduction, I am currently at the Joint Statistical Meetings, which is one of the largest statistical conferences in North America, but includes statistical associations from across Asia. So it's a very exciting place to be right now. I just want to apologize if there is any background noise, but I'm glad I could be here to share and learn with all of you. So with that, if we could go to the next slide. So I'm here to talk about why do we monetize NEIs and how do we monetize NEIs? And so when I say this, what I mean is Bruce did a wonderful job of describing all of the health, financial, and well-being impacts that can come from weatherization beyond simply saving money on your utility bill. But for many policy applications, it's really important to be able to tell the utility or the weatherization administrators, well, what is the monetary value of these benefits? And the reason is generally to balance out their cost-benefit analyses, which I'm sure many of you are familiar with from policy analysis, program evaluation, and these are very important for utility financial planning and regulation in the US especially. But an important part of why we monetize these NEIs is that without taking into account all the other benefits that are accruing, the benefit cost analysis is incomplete. Oftentimes, weatherization might be spending as much as $5,000 on a home, only to get about $500 in savings, if that. But so if you only look at the energy savings, it might not seem to balance out. But when you consider all these other benefits, not monetizing non-energy impacts can then help promote investment in these low-income programs, in programs that support climate mitigation and resilience. and overall contribute to a healthier built environment. So next slide. So how do we monetize NEIs? There are a number of ways that people have gone about this project. Here at 3Q, we primarily focus on avoided cost and measurable benefits, which Bruce already talked about our methodologies, including surveys, direct measurement, and secondary literature. But most importantly, at every step, it's important to us that the benefits and the dollar values we assign are quantifiable based on a clear line of reasoning and not inherently biased. Next slide. So starting with the residential space, which is the primary focus of the weatherization that happens in the US. We could take, for example, the concept of thermal stress. Thermal stress refers to any medical condition that is caused by being exposed to extreme temperatures that can be hot or cold. So you can think about heat stroke or hypothermia at the most extreme, but it can also be slightly less extreme versions of those conditions. So for something like this, we could use a survey to measure how often people need medical care for thermal stress before and after weatherization. And I've noted here again that ideally you would have a control group to have a quasi-experimental design. And then once you've been able to measure, okay, on average, people had slightly less thermal stress, medical costs, or medical encounters after weatherization. Now we can multiply that by the average cost of care for thermal stress. And that can be sourced from a number of places. In the US, there are a few dedicated databases that are publicly available that report on healthcare costs for the US nationally. So there may be similar data sources across different regions. So on the next slide. So just to put that into more of an equation format, and this is, again, simplified. We don't hide any of our methodology. You're welcome to check out any of our reports if you'd like to see more detail. But at a very high level, the equation looks like, the change in the average number of, say, in this example, hospital visits. And then what is the average cost of a thermal stress related hospital visit? Or if you can't get that specific, how much does a hospital visit generally cost in your area? And then sometimes we'll make additional adjustments. In some cases, the particular audience, if it's a utility or a program administrator, might only be interested in costs that are actually borne by the participants in the program. So in this case, it would be the people living in the home that is being weatherized. So we might adjust and say, on average in this area, about 10% of medical costs actually get paid out of pocket, and the other 90% are actually paid by an insurance company. So we will only count the 10% that is actually paid by the household. Now, 3Q will generally report the full value so that people can see the entire societal benefit and household benefit. But depending on the audience, we may need to be specific to their limitations on how they run their cost-benefit analysis. Another common adjustment we might do is cost of living. The US is a very large country. If we find a national estimate of a cost, we can often adjust it to the local context using cost of living numbers. In the US, it's the regional price parity. And additionally, say it's a cost estimate from a few years ago, we'll also adjust for inflation. So this is just one example. Many of the residential NEIs follow a similar logic and computational pattern. But this is just one idea of how NEIs look in the residential sphere. But of course, there are also non-residential buildings that often will participate in energy efficiency programs. And this really starts to blow up the scope. So it could be businesses, schools and universities, factories and more industrial settings, public or government buildings. All of these different building types also are eligible for energy efficiency programs in different areas of the US. And so you start to get creative about, so what might those different benefits look like in these different contexts? And so a few examples here, improved lighting can improve worker productivity, which is then a financial gain for the company if we're talking about a workplace. In a more industrial setting, better lighting may reduce accidents from tripping and falling. And also exterior lighting has been in some cases shown to reduce theft and vandalism. So all of these are really important benefits to a potential workplace or employer. Similarly, improving the ventilation and improving the overall building envelope can also reduce what's been referred to for a while now as sick building syndrome, where simply kind of bad indoor air quality and environmental quality causes some people to experience respiratory symptoms and just headache and general discomfort. And so we found that improving the building context can reduce those symptoms, again, improving worker productivity. These can also reduce things like airborne infection, as we learned during COVID-19, when many buildings drastically increased their ventilation rates, and can also affect exposure to air pollutants. And then lastly, talking about thermal comfort again, in a work setting that can improve productivity, and in a school setting, improved thermal comfort has actually been demonstrated to increase student learning and improve student test scores, which has huge implications for future life outcomes for those students. So it's a broad range depending on your context, but hopefully you can see there are a lot of ways to think about these. Next slide. So to pick just one example that is maybe getting a little dated now, but COVID-19 has not left us. But I wanted to show an NEI that took a very different path than our previous model that you saw. So for this one, we actually worked directly with an epidemiologist from the University of Michigan, Dr. Karina Grunland, who suggested to us there's a common epidemiology tool called the Wells-Riley equation, which attempts to estimate how many people will become infected with an airborne illness, such as the flu or COVID-19, based on certain characteristics of a building. So you can see here all the things you might expect. How big is the building? How many people are in the building? How much time do they spend in there? But most importantly, it's very dependent on the air exchange rate of the building, which can be affected by things like the ventilation system and the building envelope. So this, through looking at modeling how those factors of the building might change through an energy efficiency program, we're able to get an estimate of how that might impact infections within the building for workers or just occupants, shoppers, students, anyone, depending on the context. And then you can associate that again with medical costs, with missed time at work, and so on. So I wanted to share this one just in part to show really the importance and value of those cross-sector collaborations. We would have never known about the Wells-Riley equation if we hadn't been working directly with an epidemiologist. And it's through bringing in that outside expertise that we can really start to advance how we think about and model any. Next slide. Lastly, I wanted to talk about resilience in the era of climate change. More and more people are thinking about not only how do we mitigate climate change, but how do we make our buildings more resilient. So that can include things like solar panels or on-site renewable energy in case the grid goes down during a storm. It can also include in-home or in-building battery storage so that you have a backup battery source, again, if the power goes out. And there's also been a lot of advances in what are some building methodologies or retrofits we can do to better resist storms. So just recently, there's an evaluation here in the US showing that a certain standard of roof construction drastically reduced the amount of insurance claims following a hurricane. That based on the way they were able to reinforce the roofs, there's actually significantly less damage to the homes following one of the most recent hurricanes in the US. So this is thinking about, and apologies for the siren going by. Thinking about what are some of the new threats that are going to arise in a changing climate and a changing world. So next slide. So, and I admit this goes a little bit beyond energy efficiency, but in a recent evaluation we did for a program that was installing in-home batteries and solar panels, we were able to look at how much roughly how many hours of electricity would this battery system provide if the power went out? And what are those avoided costs? Like if the grid goes down, but your house still has power, what avoided costs do you no longer incur? So, for example, if the power goes out, your fridge turns off, all of your food might go bad if the power outage lasts long enough. In the worst case scenario, if you are someone who relies on a medical device, some sort of breathing machine or otherwise, you need that to live, and it needs power as well. So we were able to look at how much electricity could these battery storage systems provide, what avoided costs were there by not having the power go down. And then we actually had historical data on the number and duration of power outages in the area for this evaluation. And taking all these together, we were able to model the benefits in real dollars to the residents of having continuous power even in an outage. And I'll just note these avoided cost of power outages are sometimes captured as a metric called the value of lost load. And there's a lot of literature on this concept. There's a lot of different ways that people have tried to measure value of lost load. And we're happy to share opinions on the merits of those different ways to measure value of lost load. But we don't have time to go into the details. Next slide. So with that, as we go into the Q&A section, I just wanted to turn this over for each person here to think about what NEIs might be especially relevant where you live or work. Some things that we didn't talk about as much on this presentation, but if you live in an area with very high smog or very high outdoor air pollution, could weatherization be protecting and keeping that pollution out of the home? If you're in an area that uses coal or other, wood or other forms of biomass for heat or cooking, that can be a huge source of indoor pollution. So if there's a program that's converting those to electric or even cleaner burning gas, what could be some of those health benefits? And then similarly, if you're in an area that experiences rolling blackouts or general grid non-reliability, what are some of those NEIs associated there? So I just wanted to take a moment to kind of prompt to think about your local context. Feel free to share in the chat. But with that, I'll turn it back over to our sponsors for the Q&A. And thank you so much.
Thank you. Very good. So before I start talking, does anyone on the webinar have some questions? You can unmute yourself and ask, or you can put it in the chat function. We can look at it from chat. So I'm opening it up to everyone here. There are a lot of people now. We have a chat question. Okay. Oh, okay. We'll catch up with you later, Karan. So I guess I can start with Bruce, but Michaela can chime in as well. As you can imagine, we have people from all sorts of different climate zones, some where it's very hot and some where it's very cold. What do you see as the differences in terms of the approach in terms of weatherization, as well as an evaluation? Is there something that is unique to each of those that you'd like to emphasize?
Well, we find that there are differences in the measures that are put in homes between cold climates and very hot, dry climates, or very hot and humid climates, for example. So we were in some homes in the desert in Arizona, and they were certainly focused on air sealing and air conditioning as opposed to heating systems. We visited the weatherization program in Puerto Rico, and they focused a lot more on ventilation and windows that can be opened and solar water heaters than other places in the country. So yeah, the big difference is, as far as the evaluation approach, there may be some different health issues we would focus on from one area to the next, but the methods are basically the same. We're still going to do surveys. We're still going to try to collect direct data. We're still going to try to collect, direct cost information in all those contexts. I don't know, Michaela, did you have anything else to add to that?
think obviously cold and heat can have slightly different health impacts, but they each have their own health risks. So you can look into some of those differences. Cold and heat also affect air pollution air slightly differently. But I think a lot of it also just comes down to associated with those climates are probably also very different storm risks, right? And the differences between what are the risks from being in an area with a snowstorm versus an area that gets tsunami. But at the end of the day, a lot of the challenges and the benefits are similar, even when the risks change.
Okay. Before I forget, there are a lot of interesting studies you've done. If people want to try to learn more from the studies and get to the actual reference, what's the best way of getting to the reference?
I think if somebody just send me an email at btonn@3cube.org, I can share reports, I can share previously published journal articles and things like that.
Good. Okay. And Nazir, you'll make a note of that as well. So what do you see as the biggest gap, things that need to be done in the evaluation of non-energy impacts? A lot has been done over the years. You've accumulated a lot of experience. I'm not sure about the expertise when I think about it. I know a handful of people perhaps who've been working in this area, but in terms of gaps, is there a data gap? Is there obviously a funding gap and expertise gap? And related to that, because again, people coming from different situations around the world, they're saying, who's going to fund it? Is this, in some cases, federal, national government up at the top? Or does it go down all the way down to maybe a local government or a local public health agency? Who's going to be funding this kind of work? Who's interested in it? So combination. I'm mixing a few things up, but I think I'll hand it over to you.
Okay. Well, the funders. So we've been funded by utility companies in Massachusetts and now in Minnesota. And as Michaela mentioned, they're interested in these kind of studies to feed into their cost benefit analyses so that they can economically justify their low-income programs. We've also been funded by foundations and health agencies. So I think funding's not easy to get, but there are different types of funders out there. I think for us, the biggest gap is, or gaps are, again, more detailed information on the health benefits, because the healthcare sector has such huge financial resources compared to the energy efficiency sector. And then also blending weatherization with healthy homes measures. So if you're going to go in and you want to improve people's health, you can maybe pull up carpet if people have asthma, for example, or you're going to do some extra work to remove mold. Or you might put some extra insulation in to deal with climate issues, or you might, plant a tree outside. And so there's this big gap on how to blend weatherization with other programs, I believe. And I think the benefits could be synergistic. And so we don't have a lot of information on that.
And I'll add to that, one of Bruce's, I'm surprised you didn't bring it up. So Bruce also is a futurist, and often talks about how these impacts are going to change as climate change advances. So any impacts we see from heat now, we can measure them now, but they're only going to get worse over time.
Mm-hmm. This is where I'm not sure of what you've been following, but around the world, there are these things called Sustainable Development Goals, SDGs. Are you familiar with those?
Mm-hmm.
So do you try to tie your work into what's going on there as well? Because I would think there are lots of different, there are different groups within the SDG world. Not only there's energy, obviously, and justice and gender, etc. Can you see some of this work being tied into that?
Yes, but we haven't really done that. So we haven't
Mhm.
we haven't done a paper, for example, that links either the energy savings or the non-energy impacts of low-income weatherization, for example, to the specific SDGs. That would be a good idea for a future thing to do.
Yeah, I would think so. Michaela, are you familiar as well?
Yes, definitely. Our program had a whole section on linking data and statistics to SDGs. And so I know they cover such a broad range of topics. Um, I think it'd be interesting to think about which one of those, because obviously some are very energy related, but there's also ones related to health, well-being, food. I'm really thinking about those intersections as they relate to this work.
Right. I mean, in all my years, I'm sure Bruce as well, who are the real supporters of NEIs and evaluation of non-energy benefits and costs? Who do you, are there certain, is it, well, from your experience, and I guess often, follow the dollars, right? Who is funding the work, but not only funders, because that just gives you a good example of their interest in, but are there others, either in the private or public sector, that say, well, we should do more work in this?
Mhm. Um, well, again, certain utility companies are interested in the monetizations. Certainly people in public health, as weatherization can, possibly reduce thermal stress incidences in the general population. Um, I think they're also interested in the mental health benefits as well. Um, and the more resilient you can make a house, the more livable that house would be in terms of extreme weather events during power outages. And so I think a lot of people should be. We've the the insurance company. So there's this sector in the United States called energy service companies, and they put energy efficiency measures into a university building, for example, or a hospital, and they get paid back out of the savings, energy cost savings. And we have such a company in our building called Amoresco. And I've been trying to sell them on a project to that they could get health healthcare savings to help pay for their project. And they say, well, we can't measure the health benefits as accurately as we can, the energy savings, the energy cost savings. And so they won't do it. They won't consider it until we have better data. Um, but they're interested in it, and they would do it if the data were there. And so for us, that's just like the magic place we want to get to. We have enough data so we can convince a company like Amoresco to go in and put these measures into all kind, a whole neighborhood in a low-income community in the United States, and not only get energy cost savings, but to get healthcare to pay for it too.
And I'll
Right.
add to that
Sure.
the US context is somewhat unique in that we do not have a nationalized healthcare system. And so there's been at least two studies, one out of New Zealand, and unfortunately I can't remember the other currently, but two countries that have nationalized healthcare systems have a lot of nationalized programs, and they were able to link literally millions of records between people who received energy services and people's healthcare records to actually measure in detail those kind of health impacts. And so those types of data challenges from the US data system being so fragmented, um, in some ways, maybe some of the people on the call here have an advantage in that maybe you do have more nationalized data that is easier to link together. And in which case, I envy you and hope you go on to do that. But I just wanted to put that little bit of inspiration.
Yeah, No, that's great. That's a good point for sure. I mean, data has always been hard to get, whether it's energy or non-energy. And utilities obviously have been instrumental from the energy side. Um, and if you get somebody similar to them for providing the other non-energy data, that would even be great. And we did have earlier in the year representative of the ESCO industry, and it is booming in the Asia Pacific region. He was from the Philippines, and they're doing great work there. So I could see the ESCOs getting educated more on the non-energy benefits and costs and getting involved. If they see it, they look at it as business opportunity. I mean, they're a business, right? So if they can see that and improving or added value to what they're doing, I think they would get on board for sure.
Yeah.
Yeah. I guess we're nearing the end here. Any last minute questions from people on the webinar? Otherwise, I'll hand this over to Nazir for some concluding comments, and then I hope to see you all at our next webinar. We're trying to schedule something in September and October and November, and hopefully by the end of this year, we'll have more news about a conference for next year. We'll let you all know. Nazir, I'll hand it over to you now.
Thank you, Ed. Thank you so much, Bruce and Michaela, for the very insightful discussions. I learned a lot, and I'm definitely going to check out the other work that you are doing in this space. Thanks to all the participants. I would just like to bring your attention to the different links I have put in the chat box. We have wealth of resources on our website, including presentations from previous webinars and conferences, along with the summary notes. If you would like to take a quick look to key takeaways from the different sessions that we have organized. You can also subscribe to our mailing list and get to know what's happening with energy evaluation and the different events that we will be organizing in the future. You can also subscribe to the YouTube channel. As regarding some of the previous webinars and conferences are there, and we will be uploading upcoming webinars as well. And I would like to invite you also to share your quick feedback in a very short form, and if you have any suggestions for us. And also, if you would like to be part of webinars in the future as speakers, reach out to me or Ed. That's all for today. So we will call it a day. Thank you, everyone. Wish you a good day and good night for folks in the Asia Pacific region. Thank you so much.
Thank you.
Sicher.